Can we talk a little bit about the mind-body connection now?
I love it.
And how it helps people deal with stress, anxiety, depression?
Sure. I wrote the book Heartbreak and Heart Disease when I was 42 years old. I'm now 67, so what is that, 25 years ago? It was my best book. I have to tell you, I feel that the mind-body connection to heart disease is so profound. That's why I became a psychotherapist. I studied with Dr. Alexander Lowen. He was a bioenergetic psychotherapist. He was one of the last students of Wilhelm Reich, who talked about energy blocks from the neck down and how we block energy in the body, and that predisposes to disease. So I'm a strong believer in the mind-body connection. And when it comes to heart disease, heartbreak, whether it's unconscious or conscious, is a big factor in heart disease. And that'll clog up your blood vessels much more than cholesterol. I talked about it 20 years ago. Emotions are key. And the worst emotions are the shadow emotions like jealousy, anger, rage, hostility. Unforgiveness is probably the worst emotion. When we have toxic energetic situations, I call it toxic energy, or we have energetic blocks due to keeping people on the hook, or not forgiving people, or not living in your heart, or having bitterness. These are the factors that create heart disease. And the way it does it is through the neural hormonal mechanism. Cortisol goes up, adrenaline goes up, noradrenaline goes up, and these are the hormones that can literally predispose us to cardiovascular events as well as disease.
I talked about this on other shows. Through the schooling that I had, I did some schooling with Dr. Carl Simonton.
Oh yeah, good man. Cancer, excellent.
He wrote a book on called Getting Well
Right.
Again. And in his book he talks about something traumatic that happened in your life, maybe 2 to 3 years before you develop an illness, like a divorce, death of a spouse,
Yes.
death of a child. And in this list of different things that could happen to you, if you have one or more, you're open to this disease, whether it's cancer, whether it's heart disease, or other diseases. So can you comment a little bit on that?
Yeah, I've read a lot of Simonton stuff. He's absolutely right. Dirkie Hamanau is another German physician that his son died. He developed testicular cancer. He writes about it. There are multiple illnesses, including the ones you mentioned, cancer and heart disease, at the top of the list that are due to repressed, heartbreaking emotions. And the most important thing about heartbreak, and we all experience heartbreak in our lives. I mean, we can't escape it. And we all have dreadful events that have happened to us unexpectedly. And it's my belief that one of the best ways of healing the body with profound loss of a spouse, loss of a child, loss of a job, loss of a pet. I mean, I've seen it in every way. But when we have the loss of a vital connection, that's the key word, Sal, vital connection. And if we can't establish a new connection, like we lose a job, and if we can't find a job, because a job in a male is even a female, but a job loss is really, really devastating. And I've seen so many heart attacks in men who've suddenly lost a job and they had a heart attack. Because it's more than a loss of a job, it's a loss of self-esteem. And when we have a loss of a vital connection, the most important thing we can do, if we cannot substitute another connection, is to cry. And the problem with a lot of people in society, for both men and women, they don't show emotion. They don't want to cry. I did a workshop in the 80s, back in 1984. I had it published in Connecticut Medicine. We did a workshop at Manchester Hospital. We had 44 people. I did a stress and illness workshop. And we collected urine, 24-hour urines. And we measured the urine for stress breakdown products like cortisol and adrenaline. And what we found was that women who, during the course of the workshop, when they networked with one another, when they cried with one another, when they hugged one another, when they got angry with one another, when they were just alive and showing their emotions, when we broke the codes, the women had low breakdown stress products in their urine, meaning that they discharged all their stuff, they weren't holding on to stuff, and there was no stress in the urine. And none of these women had heart disease. So that was cool. When we broke the code on men, the men in the workshop who were like this, "You okay?" "I'm fine, I'm fine." The men who didn't cry, didn't get angry, didn't show emotion, when we checked their urine, they had astronomical products of stress breakdown products. And 4 out of those 5 men had advanced heart disease in that workshop. And what I learned was that men who don't cry get heart disease. So after I did that workshop, that was my issue. I had a difficult time crying. I played high school and college athletics. I didn't want to show my fear. I mean, I did 10 years of psychotherapy. I dealt with my unconscious self. And I realized that as a cardiologist, I needed to cry. And I went into therapy, learn how to cry, try to get out of my repressed sadness. And when I realized that the best thing to get me cry was going to a movie that made me cry.
Sad movie.
A sad movie. Now look, folks, I got to tell you out there, when you go to a movie, it's not the movie that makes you cry, but the movie touches the innate sadness we have. And the best movie that really touched me was Hoosiers with Gene Hackman. I don't know if you saw that movie, but I'll never forget it. I was with my 8-year-old son, and he was sitting next to me, and he goes, "Dad, you're crying, you're crying." I go, yeah, Drew, I really need to cry because I'm releasing the heartbreak that can lead to heart disease. I saw that movie 5 times. I saw that movie. It was better than paying a psychotherapist $180 an hour back then. So I saw that movie, and I literally discharged repressed sadness out of my body. Now, I say that to people, even when they experience tragedy, don't repress emotion. In other words, the tip of the day, if there's a tip of the day for our viewers, is that if you have an emotion in your body, whether it's sadness, grief, anger, not rage. Rage is an uncontrollable emotion. Rage scares me a little bit because we lose control. But anger, sadness, grief, allow that emotion to be released. Have the emotion. And just feel it. Don't editorialize it and say, "Oh, I shouldn't be sad, I shouldn't be angry." No, we're all sad and angry. But experience the emotion, because when you do that, you are sort of opening up the spigots that cause tension in the body. Remember, repressed anger is the Achilles heel of the cardiovascular system. We see more strokes and heart attacks from repressed anger and during fits of anger than anything. And you add sadness onto that, because remember, you're a therapist, you're a hypnotherapist. We use anger to cover up sadness because we'll go to anger first. We don't want to show our sadness because that's more of a vulnerable, repressed emotion. I like talking about, I'm a certified therapist. I like talking about the emotions because I feel the emotions are key in any illness, including arthritis.
Yeah.